So Sebastian is an economist by training with undergraduate degree at Florida State and a PhD at Vanderbilt from 2016, after which he went to UVA in the Batten School of Public Policy, and he's been there since. He does this amazing work on health insurance, in particular, both on mental health side and physical health side. Yesterday, we saw some mental health side of health insurance, and today, who knows? Who knows what we're going to see.
Yeah.
So he's got a wide range of collaborators. I counted 15 co-authors already, and so he has a very wide set of papers and interests. Yesterday, as I said, he gave a talk in Pop Health about losing insurance and behavioral health care on the mental health side. Today, you see the topic here. And then tomorrow, he'll be, for his third talk, he's giving the training seminar talk about the hidden curriculum, and which is also the name of both his water bottle and his podcast series, which he'll be describing more.
Not for sale yet, but we'll put the link down below in the show notes. Yeah.
Which he'll be describing in more detail for us tomorrow. So again, if you would like to meet him and you aren't already, let me know and we'll work that out. And please join me in welcoming here in our social science building, Sebastian Tello-Trillo.
Thank you. Thank you. And thanks for having me in awesome schedule. Jason did say about the 15 co-authors, which I never counted them, so that's pretty cool. I feel like I need to keep in mind of that stats. Anyways, I'm really excited to present this work. This is co-author with Dan Grossman, Baldwin Willage. My opening joke with this is that the R's are because we randomize the author's names to make sure that no one gets full credit. And as you can see, we order in the same alphabetical order. So I will be et al. Forever in my life, which is totally fine. I can live with that. But let's get to it. And I think you can ask questions whenever, interrupt me, raise your hand. That's totally fine. I think we have until 1:30, so we'll get to it. So across the world, many of the arguments for social safety net programs have always involved a narrative of like helping those who are struggling in families. Importantly, the children well-being. Like this is the constant narrative across the world. It's like, hey, we gotta help the children, and especially ones that are most needy. And so it's not surprising that most of the efforts in understanding these policies of social safety net programs have been focused on evaluating what happens to children's outcomes, right? And a very classical or canonical example here in the United States is going to be the case of Medicaid. It's this one big social program that we've been studying for a while. There has been an extensive literature that studies the short and long run effects of Medicaid on, you name it, mortality, labor outcomes, education, health behaviors, and so on. And again, this is no surprise because we want to understand the effects of a program like Medicaid on the people that they're targeting the program for, which is the children and so on. There has been relatively less papers that focus on the spillover effects of a social net program like Medicaid. And there have been some that have looked at the effects of parents' health insurance. So what happens when the parent gets Medicaid on the kids, and what happens on kind of like the next generation. So there's been a lot of like downward spillover effects of Medicaid. But there really hasn't been a paper about the upward spillover effects of Medicaid. And that's a paper we're writing right here. So our research question is actually very straightforward, is how does expansion of Medicaid to children affect the parents' outcomes? So we're not looking at what happens to children, what happens to the parents who they have not themselves received Medicaid, but the children may have. And we're going to answer this question by using changes in children's eligibility status through a simulated strategy that I'll explain later on parental outcomes. So we believe we're making an important contribution in kind of like three strands of literatures. First, very kind of like straightforward is the literature on spillover effects. So there's this paper by Deneve and Kawachi that they kind of like review a lot of the spillover literature within the social programs kind of like context. And they say that there's about 567 studies that meet our selection criteria that study any kind of spillover for any kind of this like social programs. But only 5 of those programs or 5 assess upward spillovers. So the notion of like spillovers has been somewhat studied, but this notion of upward spillovers has actually not been relatively studied a lot in the literature across many disciplines. This is not just economics. So think we're contributing to that literature. And the other kind of literature where I think we're contributing is the long run and intergenerational literature. So there's been a lot of people that have spoke or discovered the effects of Medicaid when I was a kid and the long run effects when I'm an adult in terms of employment and so on, and they discover mostly positive effects. And they've also, people have uncovered the effects of intergenerational effects of Medicaid. So I get treated and what happens to my kids if I get treated. And what we think we're doing here is we are uncovering a mechanism that maybe was in a lot of people's head, but has not been documented until now, of a way that is explaining how Medicaid is doing all these long-run intergenerational effects. So I think the main mechanism that people thought about is you get Medicaid, you go to the doctor, get better health as when you're younger, and that's what makes everything go super well. But we're going to discover a different mechanism, which is you receive Medicaid and your parents and your household is doing a lot better and is changing. And that's what could be driving or helping explain, as one of the mechanisms, all these generation and long run effects. But you'll notice that because of that, that could also affect the short run effects, right? So I think this paper helps reinterpret the broad literature in Medicaid, since it provides this other mechanism of understanding how programs like Medicaid can affect children, and that's directly through the parents. And we think that this kind of reasoning doesn't only need to be in Medicaid. You can think of other social programs that you can take the same idea and even the same strategy. So that's sort of the contribution that we think this paper is making. So let's answer this question straight away, which is, okay, how is it possible that parents can be affected if you treat the children, right? If you think about what Medicaid is an in-kind transfer program, right? It's not cash. We're giving the children access to health insurance. They're more likely to go to the doctor and so on. So how could that be affecting parents? And this is actually a very easy answer to have if you ever had kids. There's a lot of relief that could come if your children is protected with health insurance. So one clear mechanism is to lower financial burden, right? Regardless of the conditions of my kid, I just feel that now that my kids have Medicaid or health insurance, there's a lower financial burden in the household. And so children's Medicaid will cover expected and unexpected cost of Medicaid. There's also a reduction in stress, or what we call the peace of mind kind of like mechanism, which is for financial protection, right? But also for improvements in the children's health. So maybe the idea is that my children is healthier physically and mental health, and therefore I feel better about that as a parent. And so the reduction in stress and lower financial burden could impact a lot of the labor market decisions, marriage market outcomes, and stress-related health behaviors, which is what I'll try to show you here. So in some ways, the two ways to think about it, this is all about like stress and how the parents feeling. This is just about income, right? So this other mechanism is just saying like, this is just like the parents have like more money, quote unquote, because of that financial burden, regardless of the stress, and that's what's doing all of this. There are also other potential mechanisms that you may think of, and one possible here is like, well, what this is really doing is your kids are getting Medicaid, and the parents are now going more to the doctor, right? Because now they can take their kids to the doctor and they see more visits and so on. So we're going to try to see if we can say something about that particular mechanism and see if we can rule it out or not rule it out. But you can think of other mechanisms of how Medicaid could be affecting the parents. Great. So very short summary of the results. An increase in 10 percentage points in your children's Medicaid eligibility results in a 3.5 percentage points increase on the likelihood of the mother being married, i.e. your children get Medicaid, you're more likely to be married, and we'll decompose where we think that's coming from. It also decreases the likelihood of a mother being in the labor force by 1.3 percentage points, about a 4% effect, i.e. people are exiting the labor force and staying presumably more at home. Again, I'll speak more about that, or what we can say about that. And importantly, we see that these are where we trying to internalize as potentially positive changes for the mother, in that we see improvements in their mental health of about like 6%, depending on the measure that we're using. But this seems to be a positive thing in that sense for the mothers. And that's kind of like the short summary of the results, but we'll disentangle what those exactly mean and what we think is a full story more in the results. Great. Any questions there so far? Awesome. So what I'll do next is I'm going to explain a little bit about the Medicaid expansion that we're using. I'm going to tell you how we construct this instrument for simulated eligibility, which I always, when people presented this type of simulated eligibility papers, I was always like, I don't get it. I don't understand it. There's seems to be a lot of moving parts. So I'll try to do my best job to be super transparent about how we are actually calculating it. And then we'll talk about the empirical strategy and show you straight up the results, because there's a lot of results to consume. Okay, so children's Medicaid expansion. I'm not going to spend too much time on this, but the idea is that Medicaid is the largest provider of public health insurance for children and non-elderly adults. Initially, it was attached to cash welfare, right? So if you are eligible for welfare, you're eligible for Medicaid. By the mid-'80s, state and federal policies decoupled Medicaid from cash welfare, and states were able to expand eligibility. I.e., what this meant is like, okay, we're no longer going to say this rule that if you're eligible for cash or eligible for Medicaid, you may also be eligible for Medicaid under certain other conditions. And so that allowed a lot of like state variation in who is eligible for Medicaid or not. By the late 80s, states varied considerably in eligibility based on income and children's age. And during the 90s, there was, again, more of these changes. So a lot of what I'm saying here is that once this was decoupled from the cash welfare, you're going to start seeing a lot of time and geographical variation in who is eligible and when they're eligible, and depending on the time. So let me show you straight up the variation empirically over time. So this is a graph of simulated eligibility, which I'll talk about in a second, over time. Each blue line represents a given state, and the orange line is just the mean eligibility. What can you see here? That eligibility is changing over time for every single state, but also that there is not necessarily all states are following a very similar pattern. There's some states that do jumps here, other states that do jumps over there. It's all kind of like mix and match. And there's some like, very marked changes that happen because of SHIPs and more like federal regulations. And we see that also in the data. But that's the variation that we're going to use. We're going to use this variation in how states over time and across the states have different eligibility for different people. So as I said, we are going to use this simulated instrument strategy approach, which has been used before a lot in the literature. We usually attribute this to Curry and Gruber from '86. And the idea of the simulated eligibility is to construct a measure that we think does not have any endogenous variation in it. So I think one thing to understand is, well, why can't we use actual eligibility, right? Or even so, why can't we use just number of people who are in Medicaid? So this is a great question for like, your graphs class about why you may not want to use that. So we don't want to use like Medicaid because that involves a decision of taking up, right? And we think that's endogenous, that maybe you're eligible and some people decide to take Medicaid or not. So we don't want to do that. So then you can say like, okay, why don't you use like actual eligibility across the state? So another reason that could be endogenous is because the changes in the population themselves could make it so that the rules of who is eligible are changing depending on how the population of that state is particularly changing in a particular time. So we also want to be not concerned with that particular thing. And this is why we create the simulated eligibility framework. And in very simple high level, what it is we're going to pick a fixed population in the United States, and we're going to apply the rules from that particular year, from that particular state to that population over and over, and get the fraction of children who under those rules are eligible for Medicaid. And that's the idea of the simulated thing. So we're fixing the sample of people, and we're just saying like, okay, this is the amount of people that are eligible given this set of conditions. Okay, so how do we do this? So we use the full national CPS sample of children 0 to 17 from 1980 to 2010 and apply the eligibility rules systematically for each individual state for each individual year. And then once we do that, we're going to merge that information to our data that we're using, which is the NLSY, National Longitudinal Survey in Youth. So just an example of data, here is mother 3, right? This is a given mother that has 3 children, and in a particular year, 86, okay? These are the age of the children, and this is the state in which they're living. So each children, even though they have from the same mother, they're actually getting a different level of simulated eligibility. Why? They're in the same year, they're in the same states, because they have different ages in that particular year. So we're not just using kind of like across state and across time, we're also using the fact that this children's eligibility changes by the age in that particular year. And so there's a lot of within state variation that we're going to be able to capture that. And so each children gets a fraction of this. So what does this number mean? This 18 or 19 or 21, that when Massachusetts in 1996 for children born in 81, about using our fixed sample, about 18.5% of the kids are eligible for Medicare. That's the idea. And so on for 21 and so on. So at this point, every child year level of observations has an attached Medicaid simulated eligibility. We're going to call that SCT, and that's for state cohort, right? And the year that you're in. The next step is to aggregate that information at the mother year level, right? So as we saw here, we have this information at the kid level, but we're trying to get outcomes for the mother. So we're just going to aggregate it. And there's several ways you can think about aggregating. You can think of a cumulative thing. You can think of using older kid or younger kid and so on. It turns out it doesn't really matter. So we went with the most simplest one, which is just the average of that for that particular year. And that's what the math says here. This means that for the given mother A in year 1988, we would average out the eligibility instrument this, right, across all their kids in that particular year. And so this is math that says and explains that. So within mothers, kids may have different eligibility based on year and year of birth, age, as we discussed. This is also a good place to pause and tell you why. This is, I think, one of the reasons why we think there hasn't been a lot of papers about the spill-ups effect. And the reason is because what you really need is detailed information on the children to assign them to a treatment status, but then also link them with the parents and having all the outcomes of the parents that you really want. So that's kind of like high-level demands for a data set to have in order to implement this strategy. It's not like you can implement it with everyone. You kind of needed a particular data set that has access to state, age, year of birth, and so on. And that may be a little bit difficult. Okay, so we're gonna go from this data set to something looking like this. And all that we've done here is I'm gonna average out those 3 kids for mother 3 in year 86, mother 3 year 86. And this number is the average of those numbers. You can go and check me with the calculator, but I've done it. So you should trust me. And so we're gonna construct in a panel of mothers, right, over time, the same mother over time, and how their mean simulated eligibility is changing because the eligibility of their children is changing. And this is the setup that we're going to use to run our regressions. Yeah, and then yeah. Yeah, so I mean, they in NLSY, they always ask to all the participants, like how many kids you have and when they're born. So I just need to know like the date of birth, right? Because from NLSY, I'm able to tell where they live and I know the year. So as long as at any point they ask them, hey, how many kids you have and when they're born, I'm good to go. Yeah. I think the answer is no, in the sense that like I don't want to, like, I think getting an 80% of medical eligibility seems weird to me, because it's not that in a given state 80% of people are eligible, right? So like I feel comfortable with like I think the number that we're getting is supposed to be similar to the actual eligibility. Like out of all the children in this particular state in this particular year of that particular age, how many of them are potentially to be eligible? Oh, I see. So this first ruling does take into account some of those characteristics already. Yeah. So this is something that like a lot of people have kind of already done in constructing this particular number, and this is a number that people. And so we're just using kind of like that same methodology. Yeah. Mm-hmm. Yeah, that's right. Mm-hmm. Cool. Another important thing to notice in this data construction is like, if any particular year I did not have kids, the average of that is just going to be missing, right? And so if a particular woman does not have kids, right, they're not going to come into our data set because your eligibility is just going to be dot, right? You don't have a simulated eligibility if you don't have kids. And I know that sounds obvious when I say it, but like it's important to keep in mind that that's going to happen as a measure of our data. Awesome. All right. So now that we are all on board with that, we're going to use this variable that we constructed here to run regressions on it. And so this is the main model we're going to run. So we're going to use that average simulated eligibility for each mother in each year to regress some outcomes about mothers. So we have outcome here, simulated eligibility, and let's see what controls we're going to have. So we're going to include age of the mother to the interview. Pretty standard. It's a panel. We want to include age. Oh, yeah. Yeah, so great question. In the NLSY, we can link them very much to the mothers. They ask this question of the mothers and not the fathers. So like all men are, they are not really asked a question about children. In some years they have or not, but like it's very choppy. So we're just focusing on mothers. But I'm going to give you some information on fathers through another tricky way that we found out to do it. Okay, so age of the mother, non-controversial. We can impute individual fixed effects. This is a panel. Right, so that's obviously controlling for things like race and sex and things that are time invariant. And we think these are an important set of fixed effects, right? Once you include the individual fixed effects, you're accounting in the model in that each household can have a different level of whatever relationship between X and Y are you deciding. And we think that's important. Another thing we can include, and this is always baffling to me, it's state by year fixed effects. So what that is doing is capturing any changes occurring in each state in a particular year. So think of changes in AFDC, EITC, mother's Medicaid eligibility. All of that stuff is going to be absorbed by the state by year fixed effects. Because like, even if you think about it, once I include state by year fixed effects, and let's say I put EITC eligibility on the left-hand side, I'm going to get a 0, right? Because that's not changing within stated year itself. And that's going to absorb a lot of like really important policy variation. And then finally, we want to account for your children composition, right? So we want to make sure that we're comparing. I think the simplest way to understand it is like we want to compare mothers that have 3 kids to mothers that have 3 kids. But we want to go even more than that. We want to compare mothers that have 3 kids born in your first kid is 81, 82, and 83. We want to compare those same mothers. So we construct this. They're not really fixed effects. They're a set of children of year of birth dummies to compare essentially mothers in the same state at the same time who have kind of like the same type of composition. Or this is observing for that same type of composition of children, age of your children and quantity of your children. And we think that's going to be really important in our set of fixed effects. And so once you net a lot of those things out, what are you left? Well, you're left with really the changes in this policy level of how eligibility is being more and less generous in your state for your particular set of children, which is exactly what we want to catch. All right. So many studies have investigated the validity of the simulated eligibility or actual eligibility. Right, so this will be the first stage that I was showing you, which is like, how does your simulated eligibility predict actual eligibility? Tons of people have done this. It works. There's different estimates about 95, 85, you name it. So like we're not going to repeat that exercise again. And then also know that there's a lot of literature, right, as I showed you earlier, that have already studied the effect of Medicaid on children. And so you can imagine that these children have higher healthcare access, they're going more to the doctor and so on. So all of that is something that we know, and we're just like going to assume that we don't need to redo that literature again and just keep moving forward with the mothers. Okay, so let's talk about some data restriction. As I said, we are using the NLSY 79. Why? Because it provides us detailed information about the children and maternal outcomes at the same time. In addition, we have the outcomes of the mothers rather than the outcomes of the children's, including importantly mental health. And that's something that was super important to us because we really want to understand if these changes were improving or not improving women's mental health. Years are 82 to 2010. So a pretty nice wide range of years. Women started being 17 and 25 at the beginning of our sample and end up being 45 to 53. Why are we stopping in 2010? Well, A, because of ACA changes. We don't want to get confounded with that. Also, after 2010, a lot of these women, their children are past 18. So a lot of the eligibility goes to 0 in some way. So we were using a sample of about 62,000 observations. That's about 4,000 to 5,000 women that we're looking at, depending on the outcome. Women who don't have children do not have simulated libido associated with them. So we said that. All right, let's get straight up to the results. There's a lot to look at. Okay, so this is that first baseline effect. What is it saying? It's saying that if your children's eligibility increases by 10 percentage points, you're more likely to report being married by this 3.5 percentage points. And that's about a 5% effect if you want to divide it by the mean. Yeah. Mm-hmm. Yeah, sorry. Mm-hmm. That's correct. Yeah. Yeah, 100%. That's exactly right. Mm-hmm.
Essentially the distribution of age cutoff. Should we think of it as most of it at age 5 or like go way out to age 18?
Yeah, that's a great question. And I almost feel like I implanted it because that is something to talk about in a different paper. So this question is important about the distribution of like, okay, how many of the children are all eligible from like very generous for, let's say 0 to 5, less generous to 5 to 10 and so on. So overall, the pattern is that the younger you are, the more generous Medicaid in the state is, and the older you are, the less generous it is. That changes over time. So if I don't, let's see if I can do this. Do you have a chalk? She said I did have chalk. I don't know if I did. Okay. So imagine a graph where this is time on the x-axis, and the thing that I'm plotting is, oh yeah. Oh yeah, good call. Okay, so this is time, and this is, let's say, a measure of uniformity. So it's a 1, let's say, if all the children under 18 have the same eligibility threshold, right? And so this is kind of like, I would say like maybe 70s, and then let's say this is 80s, and this is 90s. So the way this looks is like this. And so what this is saying is that all children had very similar eligibility because there was no eligibility. And then as Medicaid starts rolling out, a lot of it, this is like only young 0 to 5, or like 1, 0 to 5, 0 to 5, 0 to 5. And then we start getting those expansions. Okay, now 5 to 10, and now 10 to 1, and up to 18. So like, what is the distribution of like how this thing looks? Well, first of all, it's changing, but that I don't know top of my head, but I do know that uniformity is changing over time. Yeah.
Maybe I'll come back to this, but I think as you get to this first result on marriage,
yeah,
I don't have a sense of what proportion of the identifying variation is essentially with 5 56 with women over 12 or 14. So pulling across relatively narrow set of cohorts on the children's side.
Yeah.
But the age of the mother is the wide span.
Mm-hmm.
So
Yeah, that's a great question. So I think we're able to answer that empirically in that we can divide the sample by number of kids, first of all, and also age of the children as well. And to answer your question directly, we're not seeing a lot of heterogeneity between those two. So it doesn't seem, at least empirical, that one aspect is driving more than the other one. That was surprising. It could be, it's just a subsample analysis, so it could be for many directions if that's the case, and also sample size gets smaller and so on. But at least empirically, we're not finding that much difference of where that's coming from. Okay, there were 1, 2, 3, 4. Yeah. So you go first. Yeah. The teen moms? Yeah. But we're controlling for age. So whatever that effect should go away. Remember, it's also individual fixed effects. So yeah.
Sorry, just one more clarifying question about what sort of variation is in this because I think you're showing us that there's variation as 5 years child, fully fixed about all of those, all of the demographic. What is the
Leftover, yeah, no, that's a good question. So again, think of the exercise of like this is that variation that we're using over time, and right, the individual fixed effects is just going to net out what is the mean of this and the mean of the x for that particular person and net that out. And then separately, right, the state by year is going to be what is the mean of this state in this particular year and net the relationship between x and y out. And then the children year of birth dummies are going to do the same thing. So I think the key thing to understand is that it's not that the fixed effects are like they're netting each separately as opposed to all together. So what we're left over is just really the variations on the policy, or that's at least what we're trying to claim. Yeah, in the back. Yeah. Mm-hmm. Could you repeat the question one more time? Fertility. Oh, yeah. Okay, gotcha. We'll have a slide on fertility. But the way you want to think about fertility is that because we're including the set of children year of birth dummies, we're essentially controlling for that children composition fertility. So I'm going to show you a regression where I put number of kids out, like fertility, and show you that there's no effect in fertility. There's also literature on this that has like mixed evidence on like what people have found. And again, this is children, Medicaid to children. And that doesn't seem to be affecting that much the decision of fertility for the parents. Surprising or not surprising for some people. Does it include what? So because you need, we are under regression, you need to have a similar eligibility. So it's only mothers. So you couldn't run that with in no mothers. Yeah. There is some variation in the income threshold, but it's a lot less. That's not really where the main variation is coming from. So we're picking some of that, but it's not the age and that. So it's kind of like, all right, so now children's 5 to 7 are going to be for the same threshold that the other ones are. Mm-hmm. Yeah. Yeah. I mean, it like you could also like, I mean, empirically we can test that in the sense of like, what if we control for income and not control and see how that changes? And it doesn't really affect it. So like that would get empirically to that if that's a really big concern. Right. And mostly because the individual fixed effects are absorbing, it's kind of like a household fixed effects, right? So they're absorbing that particular different income in the distribution that you're in. And sure, there's some drastic changes, but income is not changing that much. And I can show you that as well. Yeah. That's a great question. We're not so sure. And when we go back to the literature, we're getting 2 different kinds of answers of what it should be. So that is a great question. We don't have a clear answer for that. Yeah. So we thought we would find effect on fertility. There could be reasons, right? These are conditional on being mother already. So maybe the marginal fertility is really what we're explaining here, and that's not what's going to have an effect. So that, but we cannot look at the other way because we would have to assign eligibility to a non-mother, but that's only coming from the children. So yeah. All right. So first result, people are getting more married. Where is this coming from? First, we like to look at divorce, right? And so we see that there's less divorce and there's also less never married. So what this is saying is that 84% of this marriage result is coming from this divorce category versus 26% is coming from this never married category. So the majority is that people are remaining in marriages longer in some ways to understand this effect. Yeah. I have a slide for you. So, okay, let me answer it and then I'll show you a slide. So the standard deviation is a little bit I wouldn't rely on that, unfortunately, for this particular change. So why we picked 10 is because if you go back to this slide, and I mean, you can even see it on the graph itself. If we go back to here to up to like here, we kind of like grab the mean for each person of like, what is a 10-year increase? And that's about, it was 9.8. So we picked 10. Yeah, so you can think of it as like a 10-year change in that as opposed to a year. So year for year, right? It's a lot smaller, but that's because your the eligibility is changing. So you can also scale it for, so these are like year to year changes. So some people are changing by 0.5, right? Others like a lot smaller and so on. So yeah, no, that's a great question. So we picked 10 as a one number. There's actually a lot of numbers that you can pick. We think this makes sense, and I'll show you why in a second. Okay, so what are we finding? More marriage, really coming from less divorce, and then some never married. We're also finding effects of people exiting the labor force, right? We want to know if this is coming from employment or unemployment. So about 32% of the out of the labor force effect is coming from people coming from unemployment, and 68% from the unemployment. Oh, sorry, this is not necessarily right. So it's about like half, if you want to think about it easier, right? That are coming from the unemployment or the employment. So there's not one driving the other one. However, do notice that we're only finding statistical significance precision for the unemployment and not the employed. In other specifications, we do have precision for this employment, but again, you can take that with a grain of salt. If I personally would not interpret this as a 0, because if you interpret this as a 0, then this has to be 13, and so that doesn't really add up. But if you want to interpret it as a 0, that's also changed. We've also explored nonlinearities of this. So are there different bytes of the instrument at different levels of the instrument? There is nonlinearities, looks pretty linear in terms of the effects, and I can show you a quick graph on this. Just know that the linearities are not there. You can try to play with the nonlinearities, but it doesn't give us a lot of traction, so we kind of left it there. Yeah. I don't know. That's a good question. So I believe that NLSY would categorize it as employed, but I'm sure that, well, no, I'm not sure, but I think we can look it up to see if there's a specific self-employed. So we wanted to understand, okay, what we're seeing is more marriages and women are exiting the labor force. So presumably they're staying more at home. Maybe they're doing more schooling. Oh yeah, go ahead. No, we have not actually. That's a good question. Oh, you know what? We have checked it in the CPS, and I believe the answer, and I have to double check, is more out of the part-time employment that is coming out. No. But I should have a slide on that. That's a good idea. Yeah. Like hours of employment? So this is like kind of like a part-time, full-time. So yeah, we're seeing exited out of the part-time more than we are seeing from the full-time. But we're not seeing a lot of transitions from full-time to part-time, or at least it's kind of hard to disentangle in that. Yeah. Mm-hmm. So we wanted to understand, like, how are the women, like, is this improving or changing their mental health to understand if this is a positive or negative change? And so we look at this measure of Center for Epidemiological Studies of Depression, CSD scale. What this is actually pretty straightforward. They ask you the 7 questions about your mental health state, and you score them between 0 if you never felt that way, to 3 to like I feel all the time. So the maximum amount of points is 21, 7 times 3, and obviously the minimum is 0. So we're going to use that to measure changes in mental health. The big change in the specification from what you saw before to here is that these are asked in specific years. And so we really cannot put individual fixed effects on that because there's not a lot of that variation over time change. So these are more cross-sectional. So we think this is more suggestive, if anything. But overall, they're pretty consistent over time. This is if we pull them all together. What this is saying is that as you increase eligibility for your children, you're reporting better mental health because these are negative, right? If you want to put a number to this, this is about a change in about 1,800 points on this like scale. Another way to interpret that is that about half, a little bit more than half of the women are reporting 1 point less in one of these things. So maybe they're going from, I felt lonely, they were 56% of women and we're going from 3 to 2. on IFL alone. That's a way to understand it. But again, like there's different ways to interpret that effect. So overall, we're seeing those positive mental health effects. So now let me talk a little bit about interpretation of effects before we dive into some of the more nuanced stuff. So as I said before, other people have studied the effects of simulated eligibility on actual eligibility, that kind of like first stage component. So that ranges between 85 to 0.85. So I can use that to estimate kind of like a size for our late or local average treatment effects for Medicaid eligibility. So that means, for example, from the marriage case, that a 10 percentage points in increase in medical eligibility leads to a 0.4 or 0.36, which represents a 5.7 to 5.1% increase in marriage rates. So it's about very similar to what we had before because these are very close to 1. That's not very surprising. We can do this for all of our effects. And so I can have a range. So this is using the first stage use. This is the percent effect using the first stage of 95. And this is using the effect from our particular sample with the mothers. This is the number here is a lot smaller, but that's because this is a first stage that comes from the children. And so the first stage that comes from the mothers is obviously going to be a lot smaller by construction. But anyways, you can think of this as a range of like how we're interpreting effects. So the effects of marriage could imply an increase in marriage between 5 and 11%, 15 and 30%, and so on. So that's, I think, the numbers that we're trying to see how big or small our estimates are. Yeah, are you good? And I think the punchline of this interpretation is that, you know, some are big and some are kind of reasonable, right? So if we pick any column, let's pick the most conservative one, which is this one, right? So these are like 5% increase in marriage, 15% increases in divorce, 1% decrease in never married, 4% more out of the labor force, 6% increase in mental health. So like, if you take this column, right, there's some changes, but there's not like this drastic changes that is changing the whole composition of the United States marriage and population. This is obviously a little bit larger, and so you can pick the flavor of which one you want to use to explain that. Okay, obviously we've done a number of robustness checks to make sure that what we think is happening is happening. How sensitive is your result to different specifications? This doesn't look that great, so let me see if I can zoom it in. So we can change our specification to add or subtract things like number of kids fixed effects, or say number of kids by year fixed effects, so just different things. And here's the line of our baseline, and here are all the other estimates. Things are not changing that much. So this is where we think that fertility effect is not coming in, because if number of kids really matter, we would see inclusion or taking in and out will change things a lot, and we're not seeing that happening. And I can show you more of this graph, but I won't bore you with those particular details. But know that it seems to be that our specification relative to other specification is giving us a good measure. Another concern we had is that maybe this is all driven by mother's eligibility. So as the children's eligibility is changing, maybe this is also changing mother's eligibility. But remember that we have state by year fixed effects, so that should be absorbing that. So what we do is, here are baseline estimates. We actually have a measure of mother's eligibility that we can control for if we take out state by year. And if we do that, things are not changing that much. And then the other thing that we do is, let's drop pregnant mothers, because really mother's eligibility is about pregnant women. And so if we drop them from the sample, our estimates are not changing that much. So we don't think this is being driven by mother's eligibility changing as opposed to children's. Another thing that was important for us is mother's insurance, right? So this is the idea, your children become eligible for Medicaid, and maybe because it's a welcome ad, maybe because you're like, oh, Medicaid is awesome, I'm eligible, and now I'm gonna take up Medicaid more, and that's what's driving the effect. That didn't seem to be the case. If we look at NLSY, we run that version with mother's insurance, we don't find anything. We find something, but it's very small effect. Same with the CPS, we're not really finding any strong effects, so we don't think this is like a mother's insurance issue, even though we're finding significant effects. They're very small. Let me show you two more here that I think are interesting. I'm gonna not show you everything. We're not finding effects on migration, which we also thought could be interesting. We do an exercise for randomization inference. So what we do here is each mother, we're gonna randomly assign treatments, right? and then run all those regressions about 300 times and see where do our estimates fall on those 300 other estimates when you randomly assign things. And it better be the case that our estimate is on the one of the tails. And that's what we see here. Well, that's just what the p-values are representing. So we don't think we're capturing some kind of other type of random noise that this exercise would have captured or that our model would have captured. But let me show you my favorite robustness check because I thought it was fun. Okay, so this is where we use women that don't have kids. So our main assumption, right, is that there's no other state level policies that are correlated with this Medicaid expenses for the children that themselves may affect the outcomes of the mothers. And so what we do is we match mothers to non-mothers based on a set of demographic characteristics. So we're saying, let's grab another woman of the same age in the same states in the same year, right, that does not have kids. And then what we're going to do to that woman that doesn't have kids, we're going to assign the value of the simulated ability that their matched mother has. So we're essentially imputing simulated ability to women that don't have kids. And if our theory is correct, when we run this regression with a sample of non-mothers, we should find no effect because there could be no possible way that children's Medicaid are affecting women that don't have kids. And that's exactly what we find. There's zeros all the way. And so this makes us really sure that our specification is really capturing what we think is capturing, as opposed to any kind of like random change that is happening in the state in year, because we're not seeing any effects on the non-mothers. There's some heterogeneity analysis we did. This is one by the, I think, number of kids, maybe it's the one we were talking about. So this is 2 kids or 3 more kids. We cannot do more granular because of sample size. And I mean, there are some differences. Again, they're maybe within confidence interval of each other about where they're coming from. So this is saying the same thing of like more marriage, less divorce, and less never married. And there is some heterogeneity. It's kind of hard to rule out about if there are actual statistical difference. So this is the part where we do it. We're not sure if we want to make a lot of inference from this, but we have those heterogeneities on the paper. And a lot of this heterogeneity, what it's showing you is going to show you that the effect of marriage is there. Where it's coming from is going to change based on your race, your socioeconomic status, and so on. Yeah. Yeah, so yes, in some ways, but again, with the caveats of the thing. So that's what we wanted to do with this. So for example, we divided between high and low SES of the mother at some point in time. We're not seeing a lot of difference there for marriage, but where it's coming from is where we're picking some of the difference. So for the high SES, it's really more about remaining married, right? And then for the low SES, it seems that it's more about getting married. And so those are the things that we're getting at with that heterogeneity. But again, unfortunately, we cannot rule any of those statistical difference out. If we look at a race just really quickly, right, this is telling us that the marriage is really similar for Black and Hispanics versus non-Black and non-Hispanic, but where the effect is coming from is different. So for the non-Black and non-Hispanic, that's really coming from less divorce rather than never married, and very similar for Black and Hispanic women. Yeah. Yeah. Add the highest SES of the family that you belong to. So this is the SES of the mother's family. So the family that she grew up with. So it's not current highest SES.
That's helpful, but I wonder if that's stratifying the part on not being eligible.
Yeah, could very well be. Absolutely. Yeah, absolutely. So that's why it's sometimes used for exercise, but and like if you look at high SES, and this is where it becomes not surprising, right? So this is the employment, more out of the labor force, but the high SES are really coming from the employment rather than the employment. That's not surprising because they're highest, or they're coming from this high SES family. Versus the low SES, the effect is coming from being unemployed. right? So that's almost mechanical, but I mean, yeah. Yeah. Yeah, so the way we think about education is that because the women are aging, all of them are getting presumably more education. So we don't want to subsample by that. We want to see that as an outcome. See if education is changing given the Medicare eligibility kind of part, right? And so I can show you that, and there's no change. But that's these are all things that we think are constant, right? So is SES of the family that you came in, not your current SES. Race, we think of that as constant, like ever number of kids. So that we don't want to like do subsample by things that could be changing. We want to see those as outcomes, if anything. Yeah, those results look very similar to the high-low SES in that sense. Yeah. Let me show you this stuff. Yeah. So we later on figure out that we can redo all of our analysis with CPS, because CPS does have information about your children, your birth, and so on. And CPS is a better like employment survey that we think than NLSY. The caveat is that we cannot put individual fixed effects on CPS. So if you really think that we need individual fixed effects for identification to hold, then you should think these are suggestive. If you don't think we need them, then you can think this as like very complementary to where we're finding it. Or like, can we find the same things in a different survey? And the answer is absolutely yes. And if anything, the effects are stronger, right? Not surprisingly, we have more N and so on. So we're seeing more marriage, less divorce, less never married, more out of the labor force coming from employment and unemployment as well. So we replicate that whole exercise again with a caveat of the fixed effects. Here we can go deeper into why are you not working? So like, what are you doing more? And I think there's more categories, but very noisy. We don't find anything. The only ones that are consistent are homemaking and ill. So we're seeing a lot more women report increases in homemaking. So this is, I think, hopefully telling us, I mean, and reinforcing this idea that we had that women are exiting the labor force and they're staying at home and they're presumably taking care of the kids. And you're less likely to report being ill for that particular reason of why you're not working. This we can interpret two ways. This is just physical health. It could also be mental health, right? Or a version of that particular mental health. So I think use this as suggestive of like what that story is that we're building. Another cool one is, and I'm a health economist, so I was really interested in this, is changes in the smoking and alcohol consumption. Smoking is cross-section. I can add it to multi-year. I could also see smoking in CPS. Long story short, we're seeing less alcohol and less smoking consumption, right? So this may or may not make sense in the sense that this could be because they stay at home and because they're near children, they choose not to smoke. This could be just because they don't have time to smoke now that they maybe are presumably busier at home. Or this could be because they're less stressed and there's less need to smoke. We cannot disentangle that with our data, but we are seeing this pattern that is consistent with this idea of staying at home, of less alcohol and less smoking. Did it affect educational attainment? So we do find it a significant effect, but very, very small. So for a 10 percentage point increase in medical eligibility, there's not a lot changing for your education there. So it's not affecting education. We don't see effects on income or family income or poverty status, which is a little bit surprising, at least in our end. Granted, this could all be about precision, but even if these are all statistical significance, these are very small effects that we're finding for that. We're also able to rule out that doctor visits mechanism. Remember, they're not changing their mother's insurance. They're also not going to the doctor more. We're not finding any effects on going more to the doctor. So we really think the mechanism here is that stress, lower financial burden, you feel better about being at home type of mechanism. Yeah. They're working more at home? Yeah, household income is staying. So what that means is that the income that they had before was not making a big shift, or that the husband is earning more, maybe necessarily working more out. So what we can do with CPS is actually see at fathers. Let me show you this, but we can look at fathers and more marriage, less divorce, this is not statistically significant. So, I mean, to the extent that we think of in a heteronormative world, but we don't necessarily have to, you can expect those, and there's also age composition. So we don't expect it to be symmetric, but it's going in the same direction. But we don't see any like real changes on the labor force. So if the income is not changing, maybe because of earning more, as you grow older, you earn more, and that's what is compensating those things and making those decisions. So that's what we can say about fathers. And then relatedly, what we can say about fathers is, so in LSY, we don't see men who have kids, but we can figure out the effect of the spouses of the mothers if they appear in LSY, and we see these three things. So the employment, again, this is relatively small and not significant. We can't say much. Age, I mean, it's changing, very small. So the composition is not changing, and educational is not changing. So we're not seeing like different kinds of matching when it comes to the marriage in the terms of who the people are making, nor we see like more employment. And this is something that we also see in CPS. So I think the story about income is either that the mothers weren't earning as much, or that the fathers are compensating for that, or the spouses are compensating that for some way. So that's how we understand that. We talk about fertility. I'll just show you that regression, right? I can do number of kids on the Y, and we're not seeing an effect there. And we talked about the reasons for what that is. So we don't think fertility is really driving that effect. Okay, 11-12 or 112. So I'll wrap up. So what do we think we're learning? We think that children's Medicaid has significant implications for mothers' economics and mental health outcomes. Children's eligibility leads women to getting married and spending more time at home with their children. At least that's the hypothesis we're building. There's obviously evidence from other literature that there's better socio-emotional skills for children if a parent stays at home. This also leads to health behavior changes, right, for the mother, and represent an overall impact for the mother's mental and potentially physical health. This question, sometimes we get asked about, can this be contributing to the wage gap, right? This is for reinforcing some of the gender roles that we have, and maybe that's contributing to that. Again, like it's a little bit hard to disentangle with our estimates if it is. Maybe it is, but maybe not as much as we think. But either way, I think all of this is trying for us or telling us that Medicaid is changing a little bit the structure of the household, how it's doing. And we think this is an unexplored mechanism of the Medicaid, the effect of Medicaid in short, long run, intergenerational, and also potential explanation for other social programs. But thank you so much for having me. Appreciate it. Happy to take more questions too. Yeah. It is. And that, and you need to have restricted access to get state, I believe, which we can get, but yeah, the sample size for another. And the other thing is why we didn't start with PSID at least is because of the mental health variable, which PSID does not have. So we were looking for one that had that particular component. We could add into it, but I think the sample sizes are not sure. Given that we found things in CPS and LSY are going to buy as much, but it could be. Mm-hmm. Yeah. Yeah. Mm. Yeah. Yeah. 100%, great question. So this is a little bit about this interpretation of what can we say given that. So some things we can do of exercises, right? If you want to think about comparisons, it's like, what's another program that gives a treatment to the kids and could affect the parents? And something that immediately comes to my head is EITC, right? Which is a cash given them. But there's a big but. EITC is cash transfer given to the parents, managed by the parents. It never goes to children. Medicaid is an in-kind transfer that the parents don't really have access to unless the children use it. So they're actually very different treatments. But with that grain of salt, let's look at their comparison and estimate. So a 10 percentage point increase in EITC rates leads to about a 1.5 percentage point decrease, or sorry, increase in marriage, which is about a 3%. So if we take that 3% number seriously, what this is saying is this is a little bit higher than that. So what we can say that is we cannot rule out that is that cash doesn't have a thing. We can say maybe it's cash and maybe it's both. And we just don't know the magnitude of that. That's if you want to take those estimates seriously with that particular caveats that I mentioned about how different these treatments are. But I think the key thing, and I was talking somewhere earlier about this, is that we wanted to compare something that is similar, and that's the thing, there isn't, right? A lot of the things is like cash, and if anything, this is like the thing to compare it with, of like an income transfer and how that affects the parents. But that's part of the answer to that question. Mm-hmm. And we're not finding a lot of heterogeneity on the mental health aspect across the different heterogeneities. So you would think that the financial aspect may be, like if that matters a lot for certain type of people and races or SCS, there would be a lot of difference, and there's not. So I think, to be honest, the answer is like, I don't think I can tell it empirically, like I'll give you a precise number, but I think they're both important, and the stress and relief part, whether that comes from that financial thing, right? That's, we don't know, but yeah. Mm. Okay. Yeah. Definitely check that out. Oh.
Yeah, I'm just trying to bring theoretical implications. So if you, as provision of Medicaid for children rises, it seems as if you find that there's like a return to a more kind of male breadwinner model, in the sense that women, especially women, it seems that are working part-time, are stop working or something like that. So that's interesting because you also see like an increase in mental health wellness. Right?
Yeah.
And so I guess the story here is that like women who are in a precarious position in the labor market are those that find, let's say, more stability by stopping working after Medicaid eligibility. Is that the main story here?
Yeah, I think another simple story is why are the reasons that the mother was working? And if one of the reasons is to get some sort of employment for your kids or some cash to mitigate the potential risk of medical costs, Medicare is relieving that and saying, well, you no longer necessarily need to do that, and you can remain home. And that relief is welfare improving for them, at least. Yeah.
So, I'm not sure how to form this exactly. It's about how to think about the treatment of simulated eligibility, which is to say, you have a household of kids, and you know what ages they will be in the future. Right? Like, it's not a mystery of how long you're going to have insurance now. Right now, it's only taking advantage of these shocks, essentially. That, oh, I thought my kid was going to lose Medicaid. Now I get one extra year or some number of years. But for the younger kids in the household, they get extra years. You get all that information at once in some sense. Right? So I'm not sure if that's an interpretation question only, or if it's a measurement question, whether you actually like to change the way the simulated instrument is working to take advantage of like what information the household is getting.
Yeah, that's a great question. So we could explore this more. I think to us, the way we interpret that is to play with the definition of the instrument. And so in one version, we use, for example, cumulative eligibility for a particular child and how that accumulates over time. And so the idea there is like for the younger children, right? You know that your younger children are going to maybe remain eligible, or they're remaining eligible of that. I don't think we did this exercise thinking of that particular question, but what I do know is that the qualitative directions, the results are remain the same. Maybe it's playing about with the sizes of like what does the, and we haven't done that, but maybe we can play with that.
So, I was thinking about how to, the labor force, which I'm going to explain, is something you might.
Yeah.
Something you might not.
Yeah.
You might think, okay, we get married, this is not something that we evaluate
Right.
year by year versus the labor force thing. That's why I'm wondering if there's a way.
Yeah, kind of seeing the dynamics of those effects. Yeah, no, that's a great question. I don't think I have a good answer, and maybe that's something we can explore. Thank you.